The role of a doctor. Now, the doctor is the essential part, right? Every woman needs to have their doctor, their obstetrician gynecologist, and it's really important to have the right one here as well. Now, what many women or couples don't understand is that the doctor most of the time is not really in your birth. Okay, so the way birth starts and all is that you have surges, your water breaks, you go to the hospital at some point, whenever the time is there, and you have all the midwives. So if the midwives around, you don't have the doctor even coming at this stage. So most of the time you have any doctor who is available on the shift coming over and then checking you or not. And whenever you are 10 centimeter dilated, this is where usually the midwife contacts the doctor to tell them, okay, hey, listen, the patient is 10 centimeter dilated and it's time for her to start pushing out the baby. Or you might just feel the pushing sensation already as a woman. And then this is where the doctor comes. So depending if it's during the day, of course, the doctor is there. If this doctor works in this hospital, if it's a doctor who works in a clinic, not in this hospital, then they might come randomly as well throughout the day. But if the doctor works in the hospital, they might check up on you. Okay, they do their rounds. But if it's throughout the night, normally your doctor will not show up until you are 10 centimeters dilated. And sometimes things go even fast, which means you might push out your baby or breathe out your baby even before the doctor arrives, because the doctor doesn't always, like, they need time, right? Imagine middle of the night, they've been contacted, and then they come 20, 30 minutes later. So you can imagine this needs some time, and that's why it's also quite important that, that you know that the doctor is not the person to support you during the birth. Because sometimes I have women who tell me, oh yeah, but my doctor is going on vacation and they want to induce me because I want to really be supported by my doctor. And first of all, induction because of going on to vacation is the worst thing ever. Really, don't ever do this, okay? Because your doctor is really not playing a vital role in this birth. They are more for emergencies, okay? But still, it's important to have a good doctor who you align with. Why? Because when you come to hospital and the doctor on shift who is like taking care of you is telling you, hey, okay, we need you to go on the bed because your baby passed meconium, which is the first poop, and I want to monitor for the next 1-2 hours the baby. And now if you and your doctor are aligned and you tell your doctor, hey, this doctor on shift just told me this, what do I do? And your doctor is very aligned with your birth wishes, then he or she is putting or deciding eventually, okay? That's why still it's good to have the doctor who's aligned with your birth wishes. Now there's many doctors who are, and usually we don't find out before 32, 33, 34 weeks, because this is where the time where most women are discussing the birth plan with their doctors. And that's when they find out, oh, my doctor does not support birthing while squatting or in a bathtub or unmedicated. So, and this is where women are too shy to change still, but especially where we live here in Dubai or UAE, you can always change at any stage even. And because it's really important that you also feel comfortable with this person, okay? So there's a checklist. And these are questions which you can ask your doctor, okay? So for example, if you're really pro natural birth, which birth positions do you let me birth in? Can I birth in any position I want, like squatting, kneeling? How many cesarean births do you do out of 10 women? Okay, it's good to know. If they have a high cesarean rate, then maybe not the best doctor if your plan is to go all natural. Out of 10 women, how many get an episiotomy? Episiotomy is where they cut the woman to create more space. If this is very high, this means the likelihood of birthing on the bed is also very high, right? Also, out of 10 women, how many birth with vacuum? So where the vacuum suction is being used to pull out the baby. If this is very high as well, this means that most of the women for this doctor are birthing on the bed, on the back as well. Okay. If my water breaks, when should I come to the hospital? Ideally after 18 hours, if nothing starts. If they tell you you come directly, then that's not a good sign already. Okay. Because birth doesn't need to start immediately. It can take hours, and then you're already outside your comfort zone. You're in a hospital setting. Induction is being suggested at some stage, and this is where we leave the natural birthing path. Also, do you have wireless CGG? Because many times, if you need to have CGG, but you still want to move around, you still want to be on the birthing ball, you still want to be in the bathtub, then wireless CGG is required. So if they don't have wireless CGG, not a reason to change the hospital, but maybe depending on your plan, could be a reason as well. Okay, it's always good to have a wireless one. Now, when it comes to induction, you can ask, when would you do induce for a birth? So usually 40 weeks plus 10 days. Some doctors suggest from week 39 onwards, like, oh, your baby's getting big, and let's induce because the bones are getting hard and harder for you to push out and all of this. So please don't, if ever your doctor suggests this, second opinion directly. But other than that, some doctors even let you go further than 40 weeks plus 10 days because it's not a clock, right? Women have been birthing over 40 weeks or 41, 42 weeks as well. Now, what are the reasons for inductions? Just to know if it's the weight, not a good sign. If it's distress, well, then usually they don't do induction, but they do rather a cesarean. If it's just because you are 40 weeks, yeah, so it's always good to know and be aware of these things. If induction is because of the weight, what's the weight in kg? Yeah, is it 4.5? Is it 5 kgs? Or if it's already like 4 and it's too much for them, just know you can birth even, doesn't matter your size, your height. There is some indications with the pelvic, but check an osteopath to really know if you are able to birth your baby. And in most cases, you are. If your doctor is doing inductions, which kind of inductions is your doctor doing? Is it first the membrane sweep, for example? The membrane sweep, you need to be dilated a little bit, but this is where the doctor goes in and detaches the amniotic fluid from the cervix so that the amniotic fluid or the sac goes up and the baby comes down and puts then more pressure on your cervix to open up. If nothing happens in this case, then do they use the gel or directly the hormone drip? Yeah. If you want to have an unmedicated birth, then ask out of 10 women, how many women take epidural? Here in the UAE, we have a very high epidural rate. Sometimes what's important, if a lot of women take epidural in this hospital or with this doctor, the question is why? Is it being suggested? Because, you know, if you go into birth and you just don't want to have any medication and that's your choice, and someone comes up with this topic, oh, Yeah, I mean, do you want any pain relief? I can give you something. And then it's in your head, right? So if the epidural rate is high, maybe also not a good indication. Now, which other pain relief methods do you have? Best is really laughing gas, and I really want you to try the laughing gas because it helps for a short moment and it doesn't affect you or the baby. Now, if you do want to do water birth, which I highly recommend, is your doctor able to support this? Many are not experienced and might not be the best because they might do mistakes, which are critical mistakes. Usually, water birth is not unsafe. It's as safe as a normal birth. Just has more benefits into like how you cope with the pain, how the baby comes out, how you can actually take your baby into your arms. And then also an important factor is cord clamping. So as in, do you do delayed cord clamping? And what means delayed cord clamping for this doctor? Is it 3 minutes? Is it 5 minutes? Or is it until it's completely white? Yeah, so a good document, ask your questions, ask your doctor from very beginning onwards, because you need to know if this doctor is the right one so that you don't feel like changing at last moment.